is interesting, the definition of congestion, which is out of interest, I have shown this, is basically fluid accumulation in the intravascular and interstitial spaces due to increased cardiac filling pressures in the presence of maladaptive sodium and water retention by the kidneys. Now, why is this important? Because if you see ADHF, 83% are admitted with congestion. They have the symptoms of dyspnea and edema. The main reason for this talk is that if you do incomplete decongestion in the admission, then the incidence of rehospitalization and mortality is high in the first 3 to 6 months. And that is why this simple talk of congestion congestive heart failure. In fact, we are treating congestion all the time. I mean, there's nothing new to tell you, but a lot of interesting things which I would like to quote. Starting with the 3 simple clinical points, Forrester's classification we all know. My aim in my clinic is to keep the patient warm and dry, not excessive diuretics, not wet, not cold. And we know cold and wet is obviously the worst clinical segment. Why is this important? Stevenson, the same classification, he actually gave us with this dry, warm, cold, and wet. He just told us what is the likely therapy, which I am not going to details, but is the first clinical thing I would see in my patient of heart failure: warm, dry, wet, or cold. That's one. Number 2, it's interesting of orthoedema score. This just to highlight the point that if you compare edema and orthopnea is more sinister. And see this. So if you have severe edema or orthopnea, it is grade 2. When you have orthopnea, edema, and orthopnea, it is actually higher grade. So orthopnea is given more significance, and that is why when a patient is discharged also, clinical edema may come late, but orthopnea may come early. So this is the clinical significance of this score, that orthopnea has been given more significance.